How is minimal disease activity measured in psoriasis? Imagine trying to keep psoriasis under control without completely eliminating it. That's where minimal disease activity comes in. It's a way doctors measure how well treatment is working by looking at different parts of the disease. When psoriasis is linked with psoriatic arthritis, doctors use a special set of criteria to see if the disease is in a low activity state. This helps guide treatment goals and encourages patients to stay adherent to their therapies. The measurement includes 7 key points. First, they check how many tender joints a person has out of a total of 68 joints. If there is 1 or fewer tender joints, that's a good sign. Next, they look at swollen joints out of 66, and again, 1 or fewer indicates low disease activity. For skin involvement, they use tools like the Psoriasis Area and Severity Index, which scores from 0 to 72, or they look at the percentage of skin affected. If 3% or less of the skin is involved, it's considered manageable. Pain levels are also important. Patients rate their pain on a scale from 0 to 100 millimeters, and a score of 15 or less suggests minimal pain. The same goes for how patients perceive their overall disease activity, which is also rated from 0 to 100 millimeters. If they score 20 or less, they're experiencing low perceived disease activity. Physical function is assessed with a questionnaire called the Health Assessment Questionnaire. A score of 0.5 or less indicates good physical function. Lastly, they evaluate for enthesitis, which is inflammation at the sites where tendons or ligaments attach to bones. If there is 1 or fewer tender entheses, that's a positive sign. To be considered in minimal disease activity, a patient needs to meet at least 5 of these 7 criteria. If they do, it shows their disease is well controlled, even if not completely gone. For some, reaching even lower levels of disease activity, called very low disease activity, is the goal. This involves meeting all 7 criteria perfectly. This approach is recommended by expert groups because it captures the full picture of psoriatic disease, including skin symptoms, joint health, pain, and physical function. It's simple enough to use in clinics and research, helping both doctors and patients set realistic treatment goals. Achieving minimal disease activity is linked to better long-term health and quality of life. It encourages ongoing treatment adherence, which is vital for keeping the disease in check. In summary, measuring minimal disease activity in psoriasis with psoriatic arthritis involves checking joint tenderness and swelling, skin severity, pain levels, overall disease perception, physical function, and enthesitis. Meeting at least 5 of these 7 criteria indicates the disease is being effectively managed, helping patients enjoy a better quality of life while working toward optimal control. Always remember, individual experiences vary, so it's important to work closely with healthcare professionals to tailor treatment plans.